a butterfly. No? It's an organ with a right lobe and the left lobe and separated by isthmus. It's called an isthmus. It's a butterfly shape. Okay? And grossly it is red-brown, very vascular, and it is located in the midline of the anterior neck. This is from C5 to T1. And normally it weighs 15 to 25 grams. And your thyroid gland is considered as the largest of the endocrine glands. So, thyroid physiology. So, we have here the hypothalamus, which makes your releasing hormone, your thyrotropin releasing hormone. Siyang nag-i-instruct ng anterior pituitary to make the thyroid stimulating hormone, the TSH. Then, the TSH through the anterior pituitary instruct the thyroid gland to make the T3 and T4. Okay? So, mayroon niyang releasing, stimulating, and the target organ or thyroid hormones. Okay. So, histologically, this is the normal thyroid gland. It is also, it has also a capsule or encapsulated, and there are a lot of thyroid follicles. The functional unit of thyroid gland are the thyroid follicles. And the green one are what we call the parenchyma. Parenchyma or the stroma are the spaces between the thyroid follicles. Okay, or this is your stroma. Okay. And each one has a lobule. No? Lobule. And the lobule is made up of follicle. Okay. The follicle is lined by locuboidal epithelium and cells called the follicular cells. These are your follicular cells, or the principal cells, or the thyrocytes. They're the one who produce your thyroid hormones, the T3 and T4. Okay, these are your follicular cells. So unlike other endocrine glands that secrete their products directly into the bloodstream, the thyroid gland stores its products in the follicle. So ito ang nagpo-produce ng thyroid hormone. So after nila mag-produce, in-back muna, they stored it in the lumen in the form of thyroglobulin. Later on, pag kailangan na yan, ilalabas na nila yan. Okay? So, they have round nuclei, adequate cytoplasm, and they have a lot of organelles, specifically mitochondria, rough endoplasmic reticulum, and Golgi bodies. And the rough endoplasmic reticulum are more abundant towards the base, and they're found towards the apex naman ang mga Golgi bodies. Okay? So, this is the thyroid follicular epithelium. So, it depends upon the hormonal status of the patient. Okay? So, flattened, locuboidal, and medyo nagko-columnar. Okay. So, the structure, the pinkish material inside the follicle are called the colloid materials. The colloid are made up of iodinated thyroglobulin. Okay? So, these are inactive precursor of T3 and T4. So, kailangan silang i-activate para maging T3 and T4. So, they are chemically made up of glycoprotein, and in between the thyroid follicles are this group of cells called the parafollicular cells. No? So the parafollicular cells are known as the stroma containing C cells or the parafollicular cells. They represent only 0.1% of the gland and they produce calcitonin. Okay? Usually 10 cells per low power field in adults ang makikita ang C cells. And they are more numerous in neonates, decrease in adults, increase and appear as nodular aggregates after 60 years old. Okay, so these are your C cells. C cells or clear cells or the light cells. So versus your follicular cells, they have eccentrically placed nuclei. And they have extensive, lightly stained cytoplasm. And they produce your thyrocalcitonin. Okay? So the major action of your calcitonin is in the bone metabolism, di ba? They inhibit your osteoclast, therefore decreased bone resorption. Okay? How about parathyroid gland? So this is your thyroid and this is your parathyroid gland. So magkadikit yan. Okay? So your parathyroid gland is made up of adipose tissues and two types of cells, the chief cells and the oxyphil cells. Okay. So these are the two types of cells present. The eosinophilic one are the oxyphil cells, whereas this one, may counting pagka-basophilic, are your chief cells. Okay? These are your chief cells, and these are your oxyphil cells. Okay? And these are your chief cells are your oxyphil cells. The pinkish one are oxyphil. Oxyphil cells, while the rest are chief cells. Okay, chief cells. They're small polygonal cells with round nuclei. They're arranged in cords presenting whorl-like appearance, and the cytoplasm is irregular shape and granules, and they occasionally occur as clusters, and they produce your parathormone. Whereas your oxyphil cells, they're also known as the Hartle cells. They are larger than chief cells, found singly or in small groups, and they are less numerous than your chief cells. And the main functions of your parathormone as well as your the chief cells, they're involved in the release of your parathyroid hormone, which are involved in the concentration of calcium in the body, no, as shown in this slide. Okay, so of course, if you have high blood calcium, they have the way to detect it para maging mababa yan. So pag mababa din naman ng calcium, they have the way to detect it to elevate or to increase that calcium. Okay? So any question, guys? So I think you still have a quiz or exam at 2 p.m. Tama lang, I'm done at 1:57. So I know may quiz pa kayo. Any question? Clarification? Yes, Mr. Angge. Wala? Okay. Sino pa? Any questions? So as a summary, no, we discussed the histology of pituitary gland. So know the different histologic layers. We have the adrenal gland, the thyroid, and the parathyroids. Okay. So yun lang, madali lang. So I just shown you the important things to read and to look at in your books. Okay. So any questions before your quiz in biochemistry? Wala? Clear man, ano? Or nag-aaral kayo?